Hello, my name is Dr. Christine Anderson, and I am a chiropractor of over 30 years with experience and extra training in pediatrics and pregnancy. And tonight I'm going to talk about breastfeeding and how chiropractic can help with this very important phase of a newborn's life. So you can see there, cute little baby with the caption, Gentle Chiropractic Care for Babies can help with breastfeeding difficulties by restoring normal function. And that is a key that we're going to get into. So let's just dive right in. First of all, there's some breastfeeding statistics that are really not very encouraging. I was really surprised by this. So many new moms, 80 to 90%, really want to breastfeed their babies. They try, and by the first week, half of the moms are only exclusively breastfeeding. And then at 6 months, only 1% of these moms are exclusively breastfeeding. So this is really troublesome, and I started to delve into why a lot of moms decide to stop breastfeeding, because 80 to 90% to new moms, and then only 1% of that actually continuing to breastfeed at 6 months, that's a huge drop off. And this is where you're going to see some of the reasons here why moms stop breastfeeding. Usually they're having trouble with nursing properly and latching the baby on. A lot, and this I do hear this a lot, moms will say, oh, I didn't have enough milk supply, baby not gaining weight, or quote unquote allergic to breast milk. And sometimes there's the thing of having no support around them. Maybe there's social pressure, or being, the word is inconvenient, but it's just not working with their lifestyle. They might have to return to work. So there's all these different reasons on why moms stop breastfeeding. Now, some of these are things that I will show you chiropractic can help with. So let's go into some causes of breastfeeding problems, because if we can get to the cause of what's going on, then the issue will cease to exist. Now, a few of these are sort of after the fact, so if a baby's already born, it's really hard to go backwards, but if you are a mom who tends to have, wants to have more children, or if you are planning on having children and this is new information, this is going to really help you prepare so that you will have some knowledge how pregnancy and what goes on in the birth process can set you up for breastfeeding success or problems. So in utero constraint is one of the issues, and this is where space gets a little cramped in mom's belly at the end of pregnancy. And so babies can get into kind of weird positions and cramped positions. And so their head might be sort of tilted or flexed down, and they might not be able to move so much, especially if there is any misalignments in mom's pelvis. So when the pelvis is lined up in mom, there's going to be more space for that baby to get into head down position and be more comfortable, as well as move around. So moving in utero is really important for a baby's brain and spinal development. Then there's also the birth process itself. So there are some conditions where it's going to create an opportunity for more trauma to the spine of the baby, to the nervous system of the baby, and maybe even some other joints in their spine or their body. So things like labor induction, that's where you stimulate the start and the initiation of labor. Well, this can be a stressor for the baby, especially if that baby isn't really ready to be born, because then this leads to other interventions down the line. Now, epidural is another thing. It's anesthesia injected into the epidural space around the spine. And this can be a problem with what's going on with the baby. They can be affected by the anesthesia, believe it or not. A cesarean section. So this is another one where people think, oh, this is less trauma because we're cutting open the uterus, we're reaching in and grabbing the baby, and therefore there's not going to be so much stress on their spine. Well, that couldn't be farther from the truth. I've seen some videos and images where it's a small incision and the doctor reaches in and is wrestling with that baby to get it out. And so it can be also a source of trauma whenever you have hands on the baby. And then, of course, we have vacuum, forceps, or other manual manipulation of the baby during birth, which can put stressors on. Vacuum creates a very great force. The forceps are going to possibly compress into the brain and the skull here, which is attached to the brain. And of course, manual manipulation, if you're moving that baby around, any hands-on can affect how much trauma that baby is experiencing in the birth process. Then I put contraptions. So this is sort of after the fact. The baby is out and the baby is being put into the bouncy chair and the swings and the car seats and all these types of things, which can create stress on the spine and especially in the neck, as babies are not meant to be in an inclined position. And so this can create problems going on with the neck, the head, and even the jaw. Now I put introducing a bottle too early because what goes on with introducing a bottle is, it's been called nipple confusion. It's like, what is this? What am I getting now? With a nipple on mom's breast, babies have to work really hard to get that milk. With a bottle, it's just going to flow right down, even if you have a very small size hole. And so the baby won't have to work so hard. And so they may get a little lazy and say, yeah, I don't want to have to work. I want to go get that bottle and get the milk just really easily. So in the pink box there, you see chiropractic and decreased labor time. So there is actually a huge benefit to chiropractic. There's so many benefits in pregnancy, and I'll put a link to the description of a video I did talking about this because it is so important. Having given birth 3 times, I certainly know this. There is actually a decreased labor time with women who get regular chiropractic care during their pregnancy. So new mothers, it would be 25% decreased labor time, and if they've given birth before, it is 31%. And that's significant. So this is another reason, besides making sure this is part of it, making sure there's enough room for the baby. Guess what? If there's enough room for the baby, things are going to tend to go a lot easier. And so I really do recommend, if you're pregnant or thinking about it, you want to get some chiropractic care. All right, so how can chiropractic help with breastfeeding? So chiropractic is really all about the nervous system. People think it's about the bones and the cracking of the bones. It really isn't so. What the philosophy of chiropractic is that you have top-down control from the brain to the body. Now, granted, in newborns, this is an undeveloped brain we're talking about. They're really functioning more at their brainstem level at this point, but speaking in general, top-down control of the brain tells the body what to do. And in baby's case, the control of the brainstem, which is where they're operating, is really controlling a lot of what their body's doing. And so I'll talk about that in a second. But if you have any restrictions or interferences or compressions of that nervous system, then there is going to be dysfunction and dis-ease. So that includes the nerves going out to certain muscle groups that are needed for things like opening and closing the mouth to nurse. That means it could be affecting the brainstem, where you have primitive reflexes, which are involved in all or many of these forms of breastfeeding. In other words, rooting. That is where when you stroke the baby's cheek, they turn to the side and open their mouth. So in other words, the breast is at the side, they turn open, and therefore they're able to get mom's full nipple into their mouth, and it creates this reflex that drives breastfeeding. Once the nipple is in the mouth, we have the sucking reflex. But if there is any distortion in the area of the brainstem from issues with the back of the head or issues with the neck that are creating interference, then you're not going to have that expression of that primitive reflex. So this is where it gets really important to make sure everything is lined up, moving properly, and the mechanics of breastfeeding can occur once the nervous system is able to control that. So this is really what chiropractic is about, and what it is about specifically for breastfeeding is removing any of those interferences and those restrictions to the mechanics of breastfeeding and the neurologic system which controls it. All right, so what can chiropractic help with? Babies that have latching problems, painful nursing, so whether mom's nipples are sore or she feels like the baby's chewing on her nipples, babies that are preferring one breast over the other, or they can only nurse in certain breastfeeding positions. That tells me that they probably are not having an easy time with rotation of their neck. Falling asleep on the breast, that to me tells me that they are working way too hard. That means their suck is probably not very efficient, and this is something I check. Diminished milk supply. Once again, this is the aspect of supply and demand. So that tells me the baby is not being very efficient, not drawing enough milk from mom, and therefore mom stops production of milk. So it's not that mom isn't making enough milk, it's that the demand isn't there because the baby isn't able to efficiently take it in. Baby not satiated, same thing. If the baby is not able to latch on properly and efficiently suck and get the milk in, they're going to be hungry. Same thing for not gaining weight. So this is all sort of, you can see how it sort of builds up. Frequent or excessive spit up. This usually tells me that they're probably gulping and taking in way too much air. So that's one of the reasons for that. There may be some other reasons, but in this regard to breastfeeding, that's usually what I see. And then difficulty coordinating suck and swallow, breathe. So in other words, there's a lot that goes on we don't think about, but babies have a nipple shoved in their mouth, so they have to breathe with their nose, and they have to suck and swallow while they're breathing. And this takes a lot of coordination. So this is run by the nervous system, which is coordinating that. And if there's any issues with that, or they can't get in the proper position, for example, their head is tilted back. That's how they prefer it. There's a lot of babies who tend to arch their head. And go ahead and try it yourself and try swallowing. It's really difficult. So all these sort of mechanical things do rely on the nervous system, and so I'm looking at that. And then a really fussy or colicky baby. Again, a lot of times there might be some gas involved from taking in too much air, and sometimes it does have to do with what mom is eating. So if she's eating maybe dairy or wheat or non-organic, so full of glyphosate, there's some detective work we can do with that. and determine if what mom is eating is irritating the baby, and so they are fussy. All right, now we're going to get into some of the research, and this is super important because it is not just me saying this. There's actually been studies, there's been case studies, and even double-blind studies that have looked at what is the response to babies who have breastfeeding issues when they get chiropractic. So the first one is titled Contribution of Chiropractic Therapy to Resolving Suboptimal Breastfeeding, a case series of 114 infants. And this was done in 2009 by Miller. And in this study, 114 babies and moms presented to a chiropractic teaching clinic, and all babies were under 12 weeks of age and unable to exclusively breastfeed. So, that they saw the students, the chiropractic students, up to 9 times, and a low force technique was used to release tension and improve muscular imbalances. All of the babies showed some improvement. 3/4 of them were able to exclusively breastfeed after just 2 to 5 chiropractic visits over a 2-week period. That is really significant. So, like I said, this is one study, and in this study, they also talked about different areas that they were looking at, such as an inadequate suck reflex. And in this study, they found that almost 14% had frank signs of birth trauma, and it has been proposed that bruising and trauma to the infant's cranium, that's the skull, face and spine during birth can lead to feeding difficulties. So this goes back to what I was talking about, some of the causes. 89 of the babies, which was 78%, were exclusively breastfed after 4 treatments. And so you can see that even though this was a small study, it's very encouraging that all of the babies had some improvement in some way. So in 2016, there was another study done, and the title of it is, and I will be putting, by the way, all the links to these studies in the description so you can check them out for yourself. I really do recommend you read studies. When people say, oh, this study showed this, you want to make sure that that study actually shows it, because when I read some of them, I'm like, no, it doesn't. You're just saying, I don't know where you're getting that from. So it is really a good idea to read them, or at least the summary. So the second one, parent reports of exclusive breastfeeding after attending a combined midwifery and chiropractic feeding clinic in the United Kingdom, a cross-sectional service evaluation. So there were questionnaires given out. 85 initial questionnaires were completed, and 72 of them followed up. So that was 85% of the questionnaires were returned. On follow-up, 93% of the mothers reported an improvement in feeding, as well as satisfaction with the care provided. Prior to treatment, 26% of the infants were exclusively breastfed, and at the follow-up survey, 86% of mothers reported exclusive breastfeeding. So this really shows that we went from 26% of babies exclusively breastfeeding to 86% after chiropractic care. I really like those odds, and the really great thing is that this is a very low risk way of treating, because chiropractic is really safe, and in babies it's so gentle. It sometimes doesn't look like I'm doing anything, like I'm just holding their head. And other times it's a little, little push with my finger, or I use an instrument. So the risk is so low for such a great benefit. Let's look at number 3. This is a 2004 study. The name is Chiropractic Evaluation and Treatment of Musculoskeletal Dysfunction in Infants Demonstrating Difficulty Breastfeeding. These are mouthfuls. But they wanted to see in this study, they wanted to investigate problems interfering with successful breastfeeding. and to see if proper lactation management with a chiropractor acting as a member of a multidisciplinary team could help with the experience of breastfeeding and bonding with the mom and infant. So they took 25 infants who were having trouble breastfeeding. They evaluated them for biomechanical dysfunction. That means basically how the babies mechanically were nursing. So opening and closing the mouth, sucking with the tongue, this type of thing. And the biomechanics of 10 breastfeeding infants without complaint were also evaluated for comparison. So this wasn't double blind, but they did have a small group of babies that weren't having issues with nursing. So they used soft tissue therapies and chiropractic adjustments of the cranium, the skull, and the spine, and it resulted in improved nursing in over 80% of the patients. So this is again showing that chiropractic can be so helpful for these biomechanical issues. And what they found in a lot of babies, they were having trouble with opening their mouth wide enough to encompass the full breast tissue. And they could not close their mouth to form the appropriate suction and use their tongue effectively when they were trying to nurse. And this goes back to being very ineffective, and it would be a very sloppy suck and not much milk would come out. Also, I found interesting here, 10 of the 25 mothers received anesthesia during labor and delivery, and 10 out of the 25 other interventions were performed, like cesarean section, forceps, vacuum suction, and gross manipulation, which means going in and manipulating due to shoulder dystocia. That means the shoulder got stuck, and cord entrapment. So it goes on to talk about the different areas in the spine and the skull, and also in the upper neck, where they found the first cervical vertebra was an issue in 18 out of the 25 infants. So again, this is important because this is right where the brainstem is. So it really makes sense. And also that C1 is part of a complex of the back of the head, the occiput, C1, C2, having to do the complex motions such as turning the head and nodding. So if that's involved, it's very hard for the baby to get into the right position to nurse. So the outcome was greater than 80% of the presented infants experienced improvement in latch and ability to breastfeed. So 23 out of the 25. Pretty great results. All right, moving on to the fourth study. I know I'm taking a lot of time here, but I do think it's important that you see these things have been looked at so that you can be confident and comfortable bringing your newborn in to a chiropractor who is trained in pediatrics and pregnancy and who works with the craniosacral system as well as adjusting newborns. So these are things that I think is really important to know. All right, number 4, prevalence of musculoskeletal dysfunction in infants presenting for chiropractic care in Norway, a cross-sectional study done in 2017. And they were looking at 90 infants were enrolled. 56 infants had postural problems. So this is where they were really looking to see what was it going on with these babies that they were having a trouble with breastfeeding. So there was an issue with favorite side of cervical rotation, so able to turn one way versus the other. That was the most common dysfunction in lying on their back. Neck hyperextension was present in 21 infants. The ability to rotate their head equally side to side was in 49 children. And in total, 22 of the infants did not have the ability to sleep or lie comfortably on their back. Suboptimal breastfeeding was reported by 22 parents, and 10 of the mothers reported pain during feeding. TMJ imbalance, which is the jaw, was identified in 16 infants, and there was definitely a significance between suboptimal breastfeeding and jaw imbalance, suboptimal rooting in the sucking reflexes, and the inability to turn the head equally, and the painful breastfeeding. So these are the issues that they saw in that study. Number 5, the role of subluxation and chiropractic care in hypolactation, 2017. So this was a series of case studies looking at women and discussing how subluxation, that's the word chiropractors use for misalignments, of the cranium and vertebra may interfere with the normal neurohormonal regulation of lactation. In other words, there is a connection between the nervous system and our hormonal system. And that is what they were looking at here. And also looking at reestablishment of the structural integrity of what's going on with the alignment in the cranium and the spine. So chiropractic treatment was consisting of specific chiropractic adjustments and craniosacral therapy, resolving hypolactation in 3 cases. Hypolactation means not enough milk being produced. So remember, I talked about that as being a feedback system. If the baby isn't nursing effectively, then mom will stop making milk. In all 3 cases of this case study, there was a reestablishment of a full nursing relationship. And so the conclusion was that neurologic competence of the mother is as important as that of the infant in establishing a successful nursing relationship. And I couldn't agree more, because if mom is subluxated, guess what? She is not going to have the ability to make as much milk as she possibly could, so that there's that brain hormonal connection, and the hormones are important for that reflex of making milk. So you've got this whole symbiotic relationship between the baby and mom. Baby needs to be able to latch on effectively to be able to signal that more milk needs to be made, and then mom's brain has to interpret that signal and stimulate the hormonal system to make more milk. So I thought this was brilliant, because we often forget that mom's structural system, hormonal system, nervous system will also affect the baby's nursing. All right, last one, number 6, efficacy of an osteopathic treatment coupled with lactation consultant for infants' biomechanical sucking difficulties, a randomized controlled trial, 2016. So in this study, they had 2 groups of babies. One group got a osteopathic manipulation treatment, and the other babies, the other group, did not. It was 97 mother-baby pairs, and they were first evaluated by a certified lactation consultant who was evaluating their latch and how they nursed. And then one group received therapy and the other received what we call a sham therapy. So that's the control group. And then the lactation consultant evaluated the baby's latch after the treatment, as well as 2 days later. And the results showed that baby's feeding improved better after the osteopathic therapy, with no adverse effects noted. And if mothers had pain, their pain was improved, at least initially. Now, just a little side note, osteopathic treatments are similar to chiropractic, but they are a little bit different and a little bit different philosophy. But craniosacral therapy, the cranial work that we do, and at least the work I do based on Upledger, is often based on osteopathic methods. Upledger was an osteopath, or is an osteopath. And so chiropractic tends to focus, what we say, below the foramen magnum. doing specific adjustments on specific vertebra, whereas osteopaths, when they're manipulating the spine, tend to do more global movements. And that is very generalized, but I just wanted to let you know the difference because here I am talking about osteopathic treatment, but very similar to chiropractic. But I didn't want to note this one because it was a randomized controlled study, and the baby's breastfeeding in the group who got the adjustments did improve after the osteopathic therapy. Woof, we got through it. All right, so you have your baby in front of you. How do you know if possibly chiropractic might be beneficial for them? Well, I've listed some things here, as in unable to turn their head symmetrically. So one side, they can turn one side better than the other. You might notice when they're laying on their back or in car seat, they turn their head more often to one side, and preferring one breast over the other. This also harkens back to being able to be comfortable going on one breast where they're not on the other, so there might be some biomechanical issues going on. No or a poor rooting reflex. If they're not turning their head to the side of the breast, opening wide and ready to go, that means their rooting reflex is not working properly. This is a reflex, and it shouldn't be dependent on anything except when you stroke, the turn happens. It doesn't matter anything else because it's not brain driven. And if that doesn't occur, then you're not going to have the baby opening up wide enough for a good latch. And that leads to unable to latch properly. That would mean they are not getting the full nipple into the mouth and able to keep it there while they're breathing and sucking. So the poor suck strength. When I put my finger in a baby's mouth, I should have to really tug to get it out. That suck is strong. So if you're finding that your nipple is falling out of their mouth or they're just coming off super easily, they're probably not having a strong enough suck. Gagging is another issue with that control of breathing, sucking, swallowing. It could also be that the brainstem is compromised and it's affecting the cranial nerves involved with gagging. And so this is another reason to come in. Sometimes moms have an overabundant supply at first. So in that case, I would say, maybe express a little milk first so that the deluge doesn't overwhelm them, especially a newborn, and try and see if that helps. Noisy breastfeeding, clicking, slurping, gulping, all these mean that a good solid seal is not occurring. Gas is probably being taken in, and so they're probably also getting a lot of gas after nursing. You may feel the clicking of the jaw just sort of compressing versus there's a nice rhythmic motion that usually goes on with nursing. And the falling asleep at the breast too early, they're working too hard. It's exhausting and they fall asleep before they're satiated. And of course, any painful nursing, meaning that you're not getting a proper latch, you're not, the baby isn't in the right position, or they're not having the right biomechanics to be able to get into the right position for that optimal nursing. So this is where you can find me, Los Angeles-chiropractor.com. Forgot the .com on there. That is my website, so there is a .com. I work in many areas, but in this regard, and you can see me there working on a little baby, doing some cranial work. And so all the aspects leading up to the point where you might be breastfeeding. So fertility, pregnancy, newborn care, certainly breastfeeding issues and support, brain development, primitive reflexes, milestones, all these things are so important to getting our babies started off with more of an advantage to having full access to their nervous system and the development of their brain. So I will put some more videos talking about some of these things that are listed here. If you want more information on that, you know where to reach me. And if you are in the Los Angeles area, come on over to the office and get your newborn checked out as soon as possible after birth. If you aren't in Los Angeles, I will put a couple of links in the description that you can search for chiropractors who have had extra training in pediatrics and pregnancy, so that you know that you're finding someone who's been adequately trained in taking care of newborns. All right, have a great evening, and I will see you next time.